Hello, good afternoon, everyone. Waiting for other participants to join. Okay, we have 35 people online. All right, welcome everyone to the webinar, Unraveling Paradoxes, Social Protection for Inclusive Food Security and Nutrition. My name is Alice Richet. I hope you can hear me well. And I am a Program Policy Officer in the World Food Programme's Social Protection Unit in Rome. It's a pleasure to have you today joining us for a very special event, and it's a pleasure to be here on this panel. Before I introduce my guest, let me just give you a bit of background. This webinar has been organized on the side of the Social Protection International Conference called Reimagining Social Protection at a Time of Global Uncertainty that was organized by the Institute of Development Studies, IDS, where we are sitting right now in Brighton, UK. The webinar draws insights from the largest report by the high-level panel of experts on food security and nutrition, titled Reducing Inequalities for Food Security and Nutrition, to explore how inequalities within food systems hinder efforts to address food insecurity and malnutrition, and to discuss the role of social protection in addressing this issue. The session focuses on two intriguing paradoxes in the field. First, it delves into the reasons why income security provided through social protection often fails to translate into food security and improved nutrition outcomes. Second, it examines why social protection interventions, even when targeting the poor and vulnerable, tend to lack inclusivity. This webinar will offer compelling evidence and case studies from countries such as Mexico and India to illustrate the potentially transformative impact of social protection measures. Let me briefly introduce our esteemed panelists, and at the same time, I would be happy if you could introduce yourself, tell us where you are coming from in the chat. So I have in the center of the panel, Professor Nick Nisbet, who is a research fellow at IDS. He's also a professor of global public policy, nutrition, and health equity at the University of Sussex, and the co-founder of the Food Equity Center. He is one of the authors of the high-level panel of experts of the report of the high-level panel of experts on food security and nutrition, titled Reducing Inequalities for Food Security and Nutrition, that I was telling you about, and he will be presenting that today. He will also talk to us about the links between inequalities, food security, nutrition, and inclusive social protection. We also have in the room on his right, Professor Stephen Devereux, a research fellow at IDS, where he co-founded the Center for Social Protection and co-founded the Food Equity Center. He holds a research chair at the University of the Western Cape in South Africa, explores the linkages between food security and social protection, which he will tell us about today. We will then hear from the government side with Francisco Antonio Meza Duran, who is the General Head of Community Development of the National System for the Integral Development of the Family. He is coming to us from Mexico and will join us virtually. From him, we will hear about Mexico's recent national strategy for social protection, meals, and community development. Then, from the World Food Programme Office in India, you will hear from Aradhana Srivastava. She is a gender and inclusion officer. She will give us an overview of the Indian government's food-based social protection programs and tell us about inclusion efforts and challenges that lay ahead. Finally, we have Professor Deepta Chopra at the end of the table, a research fellow and feminist social scientist from IDS, who focuses on women empowerment, gendered politics of policy processes, and the role of women's movements in effecting policy change and countering backlash. And she will sort of give us the concluding remarks and reflections on intersectionality, inequality, and social protection. This panel will be co-moderated by Juan Gonzalo Jaramillo Mejia, on my right, a social protection program policy officer who works at the WFP together with me. And we will leave 15 minutes for Q&A at the end. Please also feel free to leave all your questions in the Q&A box. And please state your name and the organization where you work. And if your question is directed to a specific speaker, we will try to get to your questions at the end of the seminar or during the session. I think we're good. So I will leave the floor to Nick Nisbet for his first presentation.
So thank you so much, Alice, to WFP colleagues for helping organize this, and to socialprotection.org. I'm really pleased to be here. So I'm presenting on behalf of the Committee on Food Security's high-level panel of experts on food security, and it's the 18th report, which is, as Alice said, is reducing inequalities for food security and nutrition. Next slide, please. So the high-level panel of experts, in case for people who are not aware, supports the Committee on Food Security process. The Secretariat consults on emerging issues, and member states then decide on upcoming reports. FSN food security and nutrition inequalities were chosen to be the topic of this report for several reasons. Firstly, the threat to progress on food security and nutrition more generally. We're off target on hunger and nutrition related SDGs and World Health Assembly targets all round. Economic, social and environmental costs of this inequality are mounting. The commitment to leave no one behind in the SDGs in many contexts is meaningless. We need a hard analysis of who is hard to reach and why they haven't been reached so far by the SDG goals. Rights-based approaches are enshrined, but in many contexts not taken seriously enough. And we have a moral and ethical obligation to address inequality in the food system. So next slide. The high-level panel of experts Secretariat puts out a call for experts who then go through a selection process. So I'm pleased to be presenting on behalf of the whole team from diverse disciplinary and geographical backgrounds, led by Professor Bhavani Shankar. Supported by the Secretariat and the Steering Committee, and just to say that the report is a joint product of all of us, including the Steering Committee. So if we move to the next slide, I can only guide you through some of the findings of the report. It comes in at over 100 pages. There is an executive summary, which I also encourage you to look at as well. But what I can do is to try to guide you through the reports. So the report starts off by just defining a conceptual framework, which looks at the idea of inequality and equity and justice, which I'll speak to a bit in a second. And then it highlights, as I said, the dreadful progress on so many food security and nutrition indicators, and the inequalities that exist within and between countries and groups. It goes on to look at how inequalities are driven by inequalities within the food system, so land, labour, financial capital, value chains, and so on, but also broader systemic inequalities, so income, dispossession, discrimination, exclusion. Then we go on to look at actions within and outside of the food system to reduce inequalities. And then we finish with a set of principles and recommendations. Next slide, please. So we're often asked, what is the difference between inequalities and inequities? And there's many different traditions and opinions on this, but we drew on existing research and tried to work hard to provide a tighter definition. So the report defines inequalities as the observed differences in food security and nutrition outcomes between individuals or groups based on social, economic, and/or geographical position, so including factors such as income, gender, ethnicity, and indigeneity, and remoteness. But inequities are the socially, economically, or politically driven reasons why these systematic differences in food system opportunities or the unequal distribution of food security and nutrition outcomes exist. This is then taken through into our framework. So if you move to the next slide. And the framework is really a theory of change of how to improve food security and nutrition outcomes for all. We need to tackle both systemic inequities and inequities in the food system that work directly on food system factors, accessibility, availability, utilization, etc. But at whatever level we work at, whether it's within the food system or outside of the system, we also need to consider inequity in terms of intersectional inequalities. For example, how discrimination is compounded by racism and sexism, and how inequities build up as historic injustices affecting particular peoples or affecting particular geographies or existing between geographies, and also existing, as we're increasingly realizing, between generations. So when we're thinking in terms of climate justice. Action needs to be informed by existing human rights frameworks, as you see along the bottom, by more inclusive knowledge systems, drawing on different knowledges, including Indigenous knowledge. But central to all of this is how to operationalize the concepts of equity and fairness and justice. Now, this is often understood simply in terms of redistribution, and social protection often is understood to do this whether via aid flows or through fiscal exchanges within countries. But fairer distribution means also distributing costs as well as benefits. So again, debates on climate change and its impacts have shown us the need to think about how the costs of climate change are being distributed, often unfairly. But we also need to recognise that a lack of fair distribution of resources, of land, of knowledge has built up over time to become historic injustices affecting particular groups more than others. This process of recognition requires redressal through redistribution, but also through better representation in democratic processes and within the institutions from community level to national level, which are concerned with food security and nutrition. So these 3 R's, recognition, representation, redistribution, form the heart of the framework and the report. So if you move on to the next few slides, I'm just going to run through briefly some of the findings. As I say, it's quite a large report. There are a lot of findings and a lot of recommendations, and it's hard to do justice to them all. In the second chapter of the report, we focus on data, and we note how there is increasing evidence for how food security and nutrition inequalities are affecting some groups more than others, but also that in some cases the data and monitoring are not up to the task of leaving no one behind. We found in this report, and I also found in some of our work on the Global Nutrition Report in 2020, which also focused on equity, that all too often we're told that within country inequities don't exist, but when we go to the DHS data or when we go to other sources of data, the data simply aren't being collected or disaggregated on an equity basis. We move to the next slide. Chapter 3 of the report focuses on inequalities within food systems, from production, including unequal access to resources such as land or other natural resources, including, unfortunately, fishing rights, which are often forgotten and we should pay a fair amount of attention to. But we also consider food environments, which are swamping particular population groups with unhealthy food and marketing. And we look at inequalities within supply chains, including the abuse of migrant or informal labour. You move on to the next slide. In chapter 4, we then look at root causes of systemic drivers, including gender, patriarchy, inequalities persisting since colonialism, or those driven by corporate concentration and power imbalances, and also violence and conflict within households and within populations and within countries and between countries. You move on to the next slide. There's a detailed set of recommendations in the report that I'm not going to focus on in detail because I wanted to focus a bit more on the recommendations on social protection, which is the focus of this seminar today. Some of the recommendations, though, are very specific, but there just isn't the political will for them. So universal access to health and education and social protection, in order to tackle the root causes of food security, nutrition and security, are specific recommendations. They're just very hard to achieve. But more broadly, we wanted to leave a set of principles for actors in policy areas to think through the inequality and inequity considerations in their sectors and their programme areas. So we talk about an explicit focus on reducing inequalities, particularly intersectional inequalities and rising forms of power concentration. We ask for transformative policy that addresses the systemic drivers of inequalities. We ask that policy and programming in food security and nutrition are grounded from the get-go in a rights-based approach. That policies and programs are aimed at fair distribution of resources, and that in doing so, it must address the representation of marginalised groups and recognition of their rights. The policy and legislation should be informed by diverse knowledge and forms of data, qualitative, quantitative, but also different knowledge systems, including Indigenous knowledge systems. We ask that food security and nutrition policy and programming should consider the cumulative impact of multiple shocks, recognising that chronic stress is the background against which continuous crisis is placing a lot of pressure on food security and nutrition from an equity point of view. And we ask that actions that address the driver of inequalities are grounded in national and local contexts, and that all stakeholders share the responsibility to reduce inequalities in food systems. So if you move on to the next slide, as I said, one of the key recommendations of the report is to focus on social protection. We go into some detail in the report on the links of social protection to food security and nutrition outcomes, from dietary diversity to child stunting. And social protection was also the topic of an earlier HLPU report, which Stephen and others were sitting on. Social protection is key to tackling food system inequalities, and there's good evidence that it does so, both at root and immediate levels, but only when well designed and implemented. In the report, we also draw on Stephen and others here's work on the need for transformative social protection and thinking through what this means for social protection systems and for food security and nutrition. Particularly the need to move towards more inclusive, promotive and transformative approaches to social protection, which address social equity and inclusion via social protection systems, but not just by single interventions. For me, one of the most instructive points on thinking through social protection when going through the report process was something that Jane Battersby, one of my fellow drafting team members, said when she noted that although on the face of it, social protection is concerned with redistribution, so one of the 3 R's I talked about, this is nothing if we don't also think about recognition. What types of systematic deficiencies are we trying to rectify? Or who's excluded from current systems because they don't have the right papers, or they're discriminated on the basis of other means, and so on. And because of that, we also need to think through representation. Are people affected and in need of social protection also represented and having voice in program design, in policy, and monitoring, and so on? So I think sometimes social protection gets a pass because it's assumed that it's key to equity because of that redistributive potential. But our message is that it also needs to be thought through in terms of recognition and representation. Now, these principles were also embedded in some recent work we carried out with our WFP colleagues, looking at better social protection policy and programming for nutrition. The framework you see on the screen is a framework from a report that was launched last week in Brasilia by WFP colleagues called Social Protection Pathways to Nutrition. I'm not going to try and talk you through the framework here, but what it says is that if you want to tackle food security and nutrition inequality and want to do it systematically, you need to start to think through what change do you want to evoke and in what part of people's lives. How are you enabling agency? How are you enabling capabilities? All those aspects which social protection programs try to do. But how are you trying to then guide that towards food security and nutrition outcomes? And because we wanted to have an equity focus, we need to ask then, for whom is the program intended? Who's excluded? Who needs additional support to access the program? Who needs to be reached first in a system of proportional universalism? What types of changes which are relevant to food security and nutrition are we trying to evoke, whether care practices or interventions which improve the food environment or which affect prices for healthy foods? I'm going to stop there and hand it over to colleagues, but I'd love to come back. I know that Juan Gonzalo is going to be commenting on this, and Juan Gonzalo was a key member of the team which put together this framework, and which we hope draws on some of those HLPE findings. But I'm looking forward to the rest of the discussion and seeing how we can operationalize some of the lessons from the HLPE report in the field of social protection. So thanks very much for the opportunity to speak.
No, thanks everyone, and welcome to the audience that is joining us. Many more people being part of this important discussion hosted at IDS, and we're very pleased to have you today. And in fact, I think that the key message I want to really highlight is indeed, as the work done with Unravelling Carla Mejia in the regional bureau in Panama does with IDS, is the need to look not just at inequality as per se, but intersectional, interterritorial, and intergenerational inequalities. And I think that if we really understand the dimension of those concepts, we're able to really start tackling a very, very, very complex issue by definitely not just redistributing, but as a first point, as you've said, recognizing, the drivers, the people, and on what basis are people being discriminated or subject to social exclusion. But as well, how is it that we're going to ensure representation and listen to these people to ensure the quality, and that this is not just an explicit and intentional policy decision, but in fact transformative and rights-based, and we operationalize those concepts that for so many people it's still programmatically and in policy so difficult to realize. And that brings me a little bit to this concept of the 5 R's in the gender space, where we talk about caregiving and the need not just to recognize, reduce the burden that people have and redistribute kind of the burdens, but also kind of ensure that representation and reward people that are often invisible, and that social protection has that role of visibilize. So with that, I think that what we're going to do is we have incredible discussions, and I will pass it on to Stephen, who can tell us and dig a bit further into the social protection aspect of this. Nick, you've been a co-author of the High-Level Panel of Experts report in 2023, but Stephen Devereaux, Professor John Hollinon, did the very first and only report that the Committee on World Food Security has done on social protection for food security. So almost a decade between. What can we say about that? How do we bring this concept of transformation on board? And it is just a pleasure that we have the author of both concepts and papers here. So Stephen, over to you, and thank you for being with us wherever you are, colleagues.
Thank you very much, and it's great to be here and part of this panel. I want to talk briefly about 4 pathways from social protection to inclusive food security and nutrition outcomes: spontaneous reinvestment, human capital formation, linkages from protection to promotion, and transformative social protection, as mentioned by Juan Gonzalo. The first pathway is what I call spontaneous reinvestment. When a social transfer is given to a poor person, they spend that transfer, and typically if they are poor, they will spend 60% or more of any additional income on purchasing food. This also has a multiplier effect through the local economy, because every dollar spent by the cash transfer recipient is $1 of income for the farmer or the shopkeeper, or the woman selling tomatoes in the market, who benefits indirectly from cash transfer spending. This effect has been quantified by a methodology called LEWIE, L-E-W-I-E, meaning local economy-wide impact evaluation, which found in various contexts that $1 of social assistance generates $2 or $3 or more in terms of income multipliers. However, part of the money received by cash transfer recipients is not spent directly on food purchases, but on investment in micro-enterprises. For example, family farming in rural areas, or food vending in urban areas. And this investment of social transfer income has the effect of generating further income for the household, which represents a second stream of income that is additional to the cash transfer itself. In terms of the 4 components of the transformative social protection framework, namely protection, prevention, promotion, and transformation, this spontaneous reinvestment effect can be characterized as an unintended but beneficial spillover from protection to promotion. The second pathway is through human capital formation. A transfer of food to a child through a school meal, or a transfer of cash to a household that is used to purchase food for a child, boosts that child's nutritional status, which in turn should result in a healthier child who performs better in school. School food feeding programs are especially powerful in this sense, because there is compelling evidence now that school feeding not only increases school enrollment and attendance, but also to some extent performance of learners in assessments, leading ultimately to higher projected lifetime earnings and potential escapes from poverty. This again can be modeled as a link from protection to promotion. School feeding can also be used, and has been used, to address intersecting gendered inequalities. For example, by providing take-home rations to girls in secondary school to incentivize them against dropping out before boys. Additional benefits can be derived from school feeding programs if homegrown modalities are used, where food for school meals is purchased from local farmers who benefit from this structured demand and enjoy higher incomes and improved food security outcomes for themselves and their families. The third pathway is making explicit linkages from protection to promotion. For example, through Cash Plus or graduation model or economic inclusion programs. In these cases, cash transfers are given to recipients as one component of a package of support designed to protect food consumption and other basic needs, whereas additional components are intended to generate supplementary income for recipients and their households. Again, as in the spontaneous reinvestment pathway, this has the effect of creating two positive impacts for food security outcomes at the recipient household level. The first being the food value of the transfer itself, and the second being the stream of income that is leveraged by the complementary livelihood support. In the case of graduation programs, households receive an asset such as livestock, as well as training in managing the asset, financial literacy, running a microenterprise, and so on. And these programs have often been very positively evaluated in terms of their impacts. Now, all of these pathways can be seen as transformative in some sense, because they have impacts that could sustainably enhance the livelihoods of program participants beyond the direct consumption of cash or food transfers. But the results of programs that attempt to leverage reductions in malnutrition through cash transfers, even those with involved linkages to social services and economic opportunities, are often very disappointing. Immediate food security outcomes, such as dietary diversity, usually improve, but long-term nutrition status usually does not. The main reason, there are many reasons, but one of the main reasons is that structural changes are almost impossible to drive from the micro level, but require radical and coordinated action from the macro level. The transformative component of the TSP framework usually refers to structural changes in the drivers of poverty, inequality, vulnerability, and food insecurity. So I want to spend the last few minutes of my input discussing this fourth pathway, namely how food security and nutrition outcomes can be enhanced through transformative social protection. One such mechanism is through linking social protection to labor market legislation and the protection of labor rights. For example, minimum wage legislation to ensure that all workers earn a decent wage or a living wage. In South Africa 10 years ago, a farm workers' strike led to a 52% increase in the statutory minimum wage for the agriculture sector, which substantially improved all farm workers' living standards and food security. By the way, with zero exclusion error. A related example is legislation that prevents discrimination in the labor market against minority or marginalized groups, or even actively promotes employment for these groups to include them rather than systematically exclude them. Such interventions have the potential to move large numbers of people out of unemployment and hunger or dependence on social assistance into active labor market participants who are earning decent wages, paying taxes, and contributing to social insurance schemes, such as their own future pensions. Such interventions link social protection to social justice. So to conclude, this last set of measures would not normally be called social protection narrowly defined, but they have powerful impacts which positively affect the structural drivers of poverty, inequality, and food insecurity in a way that social protection is intended to do. One useful lesson, I think, is that we should move beyond academic debates around the definitions or boundaries of social protection and instead see it as a powerful toolkit that can be hooked onto investments, instruments, policies, and even laws in other social and economic sectors to achieve synergistic impacts way beyond what can be achieved through simply delivering cash transfers, food, or vouchers. The transformative power of social protection works best when it operates in combination with other sectors rather than on its own. Thank you.
Great, thanks for that. I think that those are the 2 points I think that are very clear. The pathways in which the transformative aspect is operationalized and is very concrete and is not just conceptual. And it's basically linking to legal legislatory change and certainly to that synergistic power of social protection. And I think that is always kind of a question is, where does social protection sit? And it sits on really at the interface between social, economic, labor, and the broader social equity measures that exist. And it's just right at the center as an enabler that supports for the uptake and effective utilization of services, but that require the supply of quality of those services to really support people into having their human capital development occur, but also that those spontaneous investments occur at a rate higher than what we normally see when social protection works alone. So understanding that social protection cannot do this alone, and that it's better with other sectors in the legal, in the social equity with spectrum, with legal and policy change that ensures human rights and dignity of people, but also that works together with other sectors to ensure that equality, that human rights approach is operationalized throughout. So thanks you so much for that and for bringing that transformative aspect to something very concrete, Stephen. So who should we talk to now? We are going now to have something really interesting, which is listening to Aradna, to Francisco from Mexico, from a government that has a very interesting case, and it's that they have a focus on social food assistance. So it's a mix between what we normally know as social protection and food assistance merge within a department of the government, with a community focus and with four critical areas of focus. One, certainly in the first 1,000 days, supporting the next generation from the womb until they are 2 years old. They are supporting priority groups, that are particularly excluded and marginalized from society. More generally, they follow a life cycle approach. After the 2 years of age, they ensure there's school feeding provision, and this department in Mexico has that perspective. And finally, it has an approach in supporting that social food assistance in times of shocks and crisis when bringing a community approach. So it's a really interesting example, considering that Mexico has been the pioneer of conditional cash transfers and transfers that have been particularly focused in the food systems and the food production with programs like ProAgro and ProCampo. So we're very pleased to have a government here, and Francisco, the floor is yours. I'll be happy to translate when needed. Okay, colleagues, and thank you for being there with us in the audience.
Okay, thank you so much, Juan Gonzalo. I want to share the presentation.
Perfect.
Can you see the...
Perfect, we see it there. Thank you very much.
Thank you so much. Good afternoon. I'm sorry, my English is not good, but I trying to be the better experience for all. My name is Francisco Mesa. I'm from the Mexican government, and it's an honor to share our experience in the national system of integral family development as a general direction of food and community development. I'd like to start with an epidemiological view of Mexican nutrition and marginality. According to the nutrition surveys in Mexico from 1998 to 2022, the nutrition status of children under 5 years old shows that underweight, stunning, and wasting decreased. Overweight and obesity, Mexico occupies the first place worldwide, but it is important to note that in the first years of life, the prevalence is less than 10%. Okay, about food security for 2022, Mexico presents similar numbers in urban and rural areas at the national level. In Mexico, 6 out of every 10 households are food insecurity, which represents around 20.7 million households. We can observe in this map the subnational governments with the most marginalization in the South. In the South, we have more population with poverty. In the other map, we have the percentage of marginalization for municipalities. 8.3% are very high marginalization and 23% high marginalization. Okay, emergencies and economic crises impact the food systems, favoring their breakdown. The COVID-19 pandemic has added millions of people to the ranks of the moderately and severe food insecurity, leaving them without access to safe, nutritious, and adequate food. The war in Ukraine has made the situation worse, increased cost and reduced affordability of healthy diets, but because of higher food prices and lower incomes, as well as inflation that depends structural and social inequalities. One of the most important objectives for the government of President López Obrador is to build a country with welfare. In Spanish is construir un país con bienestar, in order to 2024 Mexican population will live in a welfare environment. The National Development Plan determines the actions to help eliminate hunger, food insecurity, and malnutrition. One of the objectives is precisely the promote and guarantee the right to nutritious, sufficient, and quality food. One of the cited phrases of the government is leave no one behind, like the Sustainable Development Goals agenda. This phrase means to act in priority groups. Some of the actions of the National Development Plan about social protection are the non-contributory cash transfer programs at the Ministry of Welfare. Another action is the healthcare model for welfare at the Ministry of Health as a universal social model. In our case, at the National System of Integral Family Development, we have a vision of health service. For this reason, we have a transversal strategy of meals and community development. This strategy requires a contribution of the three levels of government: national, subnational, and municipality level in the framework of the Sustainable Development Goals. The strategy has three axes. The first one is for nutrition attention. In this case, food products are provided for a meal time with nutritional and food quality criteria. The nutrition axis for programs are operated at the subnational government level. The school meals program attends 5.6 million beneficiaries, which represents around 40% of the public elementary school enrollment. The nutrition care for the first 1,000 days program attends 239,000 pregnant and breastfeeding women and children under 2 years. The Nutrition Care for Priority Groups program attends 1.2 million beneficiaries like elderly people, disabled people, etc. The last one of the food programs is nutrition care in emergencies or disaster situations, attends 354,000 beneficiaries. These programs have 5 transversal components: nutritional education, food quality assurance, nutritional surveillance, nutritional quality criteria, and community organization. All of the programs without any conflict of interest with food industries. The community development axis is focused on the community health and welfare program. The program works by creating groups of people in localities of very high and high marginalization of all the states of the country. These people organize meetings to define their needs with different tools and with advice from a promoter. And the DIF organization gives training and community projects based on the needs that have been detected in the diagnosis addressing the social determinants of health. We have more than 1,100 groups in 530 municipalities with 23,000 beneficiaries. Okay, the last one of the axis is priority care groups. with three components: care and social inclusion, protection of vulnerable population, and another social protection supports. This component focused on the social protection services that subnational governments needs to provide, preferably care for older adults in their homes, resilience and attention to the population in emergencies, attention to people with disabilities, and attention to early childhood, as well as girls and boys with those who are migrants. The national system of integral family development have changed the vision of assistance to protection of human rights, which generated a new perspective considering resilience, community development, and peace. We recognize that the school feeding is the key to development and social equity and represents a tool for social inclusion, and it's the largest social safety network in the world. And the results, the National Council for Evaluation of Social Development Policy, is Coneval in Spanish, reported a historic decrease in poverty since beginning on the fourth transformation, like this government. We demonstrate the effectiveness of Government of Mexico strategy under the premise for the goodness for all, the poor people first. Between 2018 and 2022, the percentage of Mexican population living in poverty decreased from 41.9% to 36.3%, representing a change from 41.9 to 46.8 million of people. After this work, we learned the following. 1 second. Okay, sorry. This is the correct slide. After this work, we learned the following. We need of interinstitutional collaboration to consolidate the coordination between the Ministry of Health, Education, Welfare, Indigenous Population, Economy, Science, and Technology to promote actions that strengthen food and community development programs. We have the proposal for school feeding for all and the transition for industrial meals. We need to increase the number of food spaces in schools to transition for processed meals to in-schools prepared meals. Expand the community garden project in localities to encourage self-consumption of regional and fresh foods, as well their production and sale to improve the family and local economy. Consolidate effective mechanisms for public purchase from small producers, which strengthen the consumption of regional and fresh foods and empower communities through the practice of fair and equality trade. We need to promote the creation of community networks for social cohesion and promotion of peace. Keep an organization between communities to be resilient and prevent the violence. Thank you for your attention. The following are my contact information. Thank you to all.
Thank you, Francisco. And certainly you're speaking better English than I am. And that was extremely well explained about the policy and the incredible progress that Mexico has had in the reduction, not just of poverty, but stunting and different forms of malnutrition. And I think that, you know, we would be very happy to see data that is helping us to kind of understand how the two reductions actually speak to each other, reinforce each other with such a comprehensive policy engagement. And I think that a key message I think we get from here is that intersecting forms of inequality that come from different social, economic, spatial require as well intersectoral action in which social protection comes again, as we mentioned with Stephen, as an enabler, as a connector, as a catalyzer really of the actions taking place in the social and economic dimensions. Now, without further ado, we wanted to give you in the audience a perspective, not just from Latin America and a pioneering country as Mexico in this sector, but of India. And now we're moving from having, obviously, as important as it is, the perspective of a government, but now from an international development and humanitarian organization as India. And we have Aradna here, but we also have the great pleasure of counting with a researcher that has focused a lot on the inequalities taking place or being addressed in the country. And we have Deepta here, which is such a pleasure as well to give us some thoughts about this. So Aradna, I would like to welcome you to tell us a little bit about the world's largest food-based safety net. And thank you so much for being with us.
Thank you. Thank you so much. It's a pleasure to be in this webinar today. My presentation, and may I request Fabiana to please share it. I would say it's a good progression from what was presented as the Mexico case study. The focus is not so much on the data as much as it is on the processes. Now, the World Food Program in India is very different from the humanitarian organization that it is in the rest of the world. And the reason behind it is what I will try to unravel in this presentation today. Next slide, please. So India, as you would be aware, of course, is that it's the world's most populous country, more than 1 billion population. It is also a relatively stable democracy with strong structures and systems, legal frameworks, and that has resulted in some of the world's largest food-based social protection schemes. It is a country where food security has been declared as a legal right to 2/3 of its population in an act which is known as the National Food Security Act of 2013. So there is a lot of focus on enhancing food security and nutrition of the population in India, though it continues to be a matter of concern, given that close to 40% of the population does suffer from some or the other nutritional or food access issue. Now, the World Food Program was earlier into food assistance and cash assistance programs in India. However, the government of India then requested that what they would feel WFP would be able to add more value in is strengthening their capacities to actually improve the coverage and efficiency of their own food and nutrition programs. And that's how since 2012, WFP has entirely taken up the role of country capacity strengthening rather than really any kind of food assistance. We work solely and entirely with the government. We provide technical assistance to strengthen their the implementation of their food and nutrition programs. And we also have some programs to strengthen their capacities, so which is like about training of government officials or implementers at the community level. And another aspect of our work is generating evidence to actually inform the policies and programs where if we feel there are certain groups that are being left out, giving that evidence to the government that here are the issues which need to be addressed. So kind of naturally, our work has progressed very significantly into the inclusion space. Given that social protection programs in India are very strongly structured, it has been for us a constant, I wouldn't even say a challenge, but definitely a very persistent engagement to be able to address some of the really institutional issues as well as the people-centered issues, which we felt were really, in hindering the universal access of the programs to the intended beneficiaries. Next slide, please. So in a nutshell, the structure of the programs in India, it again follows a life cycle approach. We have a very comprehensive program for children, addressing young child nutrition through take-home rations, as well as nutrition of pregnant and lactating women, again through take-home rations. which are specifically addressing the nutritional needs of that particular category of beneficiaries. We have hot cooked meals which are being served at centers to children which have started complementary feeding, and also to pregnant women and breastfeeding women. We are strengthening, the second row actually describes how WFP is broadly strengthening these programs. And so the first set of programs, that is the Integrated Child Development Services, addressing pregnant and breastfeeding women and children up to 6 years of age. We are strengthening that program by fortification of the nutritional supplements that are being provided through social behavior change communication, addressing areas of nutritional behaviors, health and hygiene. We are also trying to improve the supply chain of the take-home rations that are being provided. And we are also piloting gender transformative approaches by especially an intervention around women's self-help groups actually producing these fortified rations. So it's locally procured and then locally consumed. Moving on to the 6 to 14-year age group, significantly it is the school feeding program, which is known as the midday meal scheme in India. About 120 million school children are covered. And again, here we are supporting fortification of the school meals that are provided, along with some social behavior change communication on nutrition behaviors, health and hygiene. We are also improving the supply chain and also, again, using gender transformative approaches, increasing the involvement of women's self-help groups in providing the meals that are being served in the schools. In the adolescent years, we have special schemes, particularly for adolescent girls. It is aimed, it's called Sabla or Kishori Shakti Yojana, and these is aimed at improving the nutrition of adolescent girls. And typically, girls are identified through the midday meal scheme, where they are targeted because they are not of the optimum nutritional status, and then the Kishori Shakti Yojana not only provides supplementary nutrition, but it also provides education, basic education around confidence building and empowerment. Then is the targeted public distribution system, which is a household-based program. The targeting is as per households. The coverage is 800 million people, which is roughly 70% of the households in India are actually covered under this program. It provides highly subsidized grains as rations on a monthly basis, and in terms of entitlement, about 5 kg of grains per person per household, and so up to 5 member households typically. This is really one of the most comprehensive food assistance programs that the government runs. However, it is again basic food assistance, so it does not really digress beyond food grains. We have wheat and rice primarily being provided, and now there is some amount of coarse grain that is also being promoted, that is millets. We've done a lot of interventions around improving the coverage and efficiency of this program, and I will be talking in some detail about it subsequently. Next slide, please. So I am basically going to present 3 kind of examples of the nature of work that we do around enhancing inclusion in social protection schemes within that are being implemented by the government and that are focusing on food and nutrition. So here is the first example of what we have been providing as technical assistance to enhance the inclusivity of the targeted public distribution system. Here, one of our earliest interventions was around computerization of beneficiary records. Now you can imagine with 800 million people, it was very difficult for the government to really keep track of how many of these beneficiaries or the households that were getting the benefits were really eligible or not eligible. And so we piloted an approach, a very intensive approach in one of the states called Odisha, where we actually ran a campaign to check each and every household that was registered as a beneficiary, to remove duplications, and also include those beneficiaries that had been left out of this scheme on the basis of criteria that have been set. Our limitation was that we could not influence the criteria as such. So that is something that the government has already set. But then we continued to engage with the government on it. And then we were able to actually support the government in defining some auto inclusion criteria, that if there are these five categories, criteria being fulfilled, the household must be included in the scheme. Some examples I've stated here, like a destitute that is living on alms and there's no other source of income, or if a person has a 40% disability, whether or not the person is economically challenged or not. But if the person has a high level of disability, the person would be eligible for getting benefits under this scheme. So these were some of the areas where we consistently were able to engage with the government and influence the way the criteria was set. Computerization of the entire system really brought about a lot of transparency. We also strengthened the community feedback mechanisms through a series of, besides the supply side intervention of improving the mechanisms of capturing feedback, we also had ran parallelly awareness campaigns so that more and more people would use the system. We made the numbers, the customer helpline or the beneficiary helpline numbers more visible. We put up posters which and the posters are visible in the picture that I've shared here, which shared all the basic all the key components of the scheme, so that people's awareness is raised and people know whether they are getting their entitlements, or if there's any issue where they can call and raise a complaint. Besides that, there is a special scheme for migrants which came up particularly around the time when COVID struck, and a lot of migrant households, because of the shutdown, the lockdown, were deprived of their food entitlements. That was a time when we came up with specific special schemes to raise awareness of migrants as to how they can still access their food entitlements. So this in a nutshell was really a basket of interventions that we worked with the government on to enhance the inclusivity of the targeted public distribution system. Our success was from the fact that through this pilot in one state, the entire system was then adapted by the central government or the national government. And now the entire country's targeted public distribution system has been computerized. And we continue to be the primary technical assistance providers to help maintain the system and further strengthen it. The community feedback mechanism has also been centrally consolidated. There has been a lot of enhancement of the scheme's features, in which we have really played a very strong role, and we continue to do that. So this has really been, and it took us close to 8 or 9 years to actually get there. But then we've really been able to do really significantly improve the delivery of this scheme. Next slide, please. Now coming to 2 other categories of groups that we wanted to work on, and we hadn't really addressed these issues earlier in that depth. So the first example here is of a disability inclusion assessment. So we wanted to address the issue of disability inclusion in the social protection schemes, particularly the ones on food and nutrition. The government of India has, all of these schemes actually have special provisions for how to enhance the inclusion of, or to reach the persons with disabilities, to address the specific barriers that they would face in otherwise accessing these schemes. However, the special provisions may or may not be functioning on the ground, but then there was no evidence really to engage with the government about it, and that's how we decided that we needed to generate some evidence. We conducted 2 studies here, one in the state of Odisha in eastern India, one in the state of UP or Uttar Pradesh in northern India, around the barriers that persons with disabilities face in accessing food-based social protection schemes. Before we started with our study, we actually had a discussion with the national government, particularly the ministry that deals with it's known as the Department of Empowerment of Persons with Disabilities. They in person accepted the concept. They said, okay, please go ahead and generate the evidence. We would welcome it, and then we will convene a multi-departmental meeting in which you can then share your evidences, and we will then jointly develop a strategy to address these issues. The evidence actually showed that, besides there were physical accessibility challenges, social accessibility challenges, challenges in the attitude of the government officials that were delivering the schemes. And there was a whole range of issues that did come up. These issues were then, so we prepared a report out of it. Now, here comes the challenge actually. In the beginning, and this is something that I've seen in several studies that we have been doing with the government. In the beginning, there would be a support to go ahead with the study, but then there are times when once the results are available, the government may or may not want to take them up further. So we have been, again, then this becomes a really long process of engaging with the government, persistently trying to impress upon them the importance or, how vital it is to really address these issues. And that the good thing then is that coming from the World Food Program, the government is also open to accepting these suggestions, but then it really is a long and persistent process. And in this case, we have shared the findings with the government of Odisha. We are still waiting to hear back from them for a more formal sharing. The government of India is very keen to take up the sharing, but then the sequence is that we first share it with the state government, and then once they okay it, we bring it to the center. So at this point of time, we are still waiting for sharing it with the state government, and then we bring it back to the central government, where a broader policy guideline can be issued based on the gaps that we have highlighted through this assessment. Next slide, please. So similar to this example is the one on indigenous peoples, where we've been looking at the food security and vulnerability issues of tribal populations, again in 2 different states. This is again through a set of studies. We generated evidence around how tribal populations, given their more remote locations, greater dependence on their local ecosystem, greater vulnerability to the changes of, to the vagaries of climate change, were actually facing relatively greater food insecurity issues as compared to non-tribal populations. Again, the story was of persistent advocacy, and here I've mentioned the example of Rajasthan government, where it took us 2 years. We completed the study in 2021 January, and it's only now this month that the government has finally said yes to a pilot proposal by WFP to actually address some of the issues that we highlighted. Particularly, the issues are around women's livelihoods and also enhancing child nutrition. And so this is just to share, how evidence generation is a very important part of highlighting key issues or challenges that social protection scheme implementation actually leads to or faces. But then what is really also important is how persistent you are with the government to ensure that those suggestions or the areas that you are highlighting are actually then acted upon. Next slide, please. So to conclude, basically, as I mentioned, some of our challenges were to get the government's buy-in on the proposals that we were making to address the issues that we had highlighted. Consistent engagement was also required because with the change in, say, parties in power or with change in bureaucrats, there would be a change in government priorities as well. It was a lengthy process of discussions, so which we really have to keep on up with. Another issue was that we really didn't have much of a control over the program. It was the government's program. So a lot of the changes that we would otherwise desire would not necessarily be possible. However, it is still a huge opportunity. I don't think WFP with its own program in India would ever be able to really reach out to the scale at which the government actually reaches out. And so this is definitely, in spite of whatever the challenges are, what we need to do. And of course, we need a lot of persistence, tact, we need technical proficiency as well to be able to generate really good, solid, credible evidence and demonstrate feasibility of solutions to the government. So with this, I end my presentation. Thank you so much.
Great. Thank you so much for that presentation. There's so much food for thought, and I think that we want to really unpack some of the key elements here. And the key element is we're looking at the largest food-based safety net in the world, with the largest population in the world as well, in which for 2/3 of the population, social protection is a right. And that comes back to the discussion of like, what is the role of legislation to enable social protection to realize its objective. But we see that still, even if it's a right, even if huge government resources are put here, there are a lot of challenges that are hindering access to this universal kind of social protection programs. And it's been very useful to see the life cycle, to understand the different interventions, massive amount, and the very well thought interventions with an integrated system for children, for priority groups across the life cycle, but that there are differences within the differences, that we cannot take this for granted, and that within a stage in the life cycle, we would have discrimination based on tribal issues, ethnic issues, and disability issues, and that the role of an organization as WFP is not just humanitarian and in delivering here, but actually in enabling what? Governments that are at the center and they're responsible ultimately for social protection. So here, WFP has a capacity strengthening and advisory role. And basically it's identifying the barriers. What are those? How can we advocate and raise awareness with government of those barriers to inform policies as the ones that we saw in Mexico that can further strengthen and adequately meet the needs of people, evaluating options, and with the evaluation of those options, always partnering with these civil society organizations, right? So we have that intersectoral view of things to really find the mechanisms that can work here. We've seen how there are specific interventions in expanding coverage, which is what we see is the main objective in the target 1.3 of the SDGs, which is building these universal systems, but expanding substantially coverage by 2030. But that's not enough. Registering people, we need to listen to people and to really adopt the people-centered approach by having a consultation process and an effective complaints and feedbacks mechanism. We know that this is not enough, that monitoring and evaluation is needed, and that some programs need to come in place for groups that, as always happens, unfortunately, are invisible in many countries, such as migrants. So we have had disability, tribal issues. Now let's look a little bit about gender, for example. How do we go a little bit further and really impact this issue of intersectionality, bringing the complexity of the lived realities of the people that social protection wants to serve here? And hopefully we'll have a comment from the audience around the experiences of making inclusion for indigenous populations in the Amazonia, and really give you, the audience, a perspective around those different inequalities. What are the shapes? What are the commonalities between them? And how can social protection make a difference? So, Deepta, a pleasure to have you and to hear a little bit more about your research, which has been so path-breaking as well, as Nick's and Steven. So thank you for being with us.
Thank you. It is really a pleasure to be here and speak about something that is not only something that is a subject that I study and I'm very passionate about, but also ties in with the lived experiences of large amounts of the world's population, including myself. As Juan Gonzalez said, just to look a little bit deeper into aspects of gender, I'm going to focus my comments around two main points. One is intersectionality, and the other one is visibilizing something that is very invisible, and I'll tell you what that is. Any answers in the chat box will be greatly appreciated. So you might want to think about what this invisible thing is while I speak about the first aspect. Intersectionality. While we all know that there are intersectional or there are different drivers of vulnerability, what I would like to really draw your attention to is the fact that gender probably cross-cuts every single one of those vulnerabilities, right? So women are not only overrepresented and, in statistics of the poor, the marginalized, but also in vulnerability statistics. And this is because of gender-specific constraints of the gendered nature of risk and vulnerability, both economic risks in terms of not having enough resources, but also social and political risks. But on top of that, inequality itself is also gendered. As I said, women not only have unequal access to resources, but they also have lack of political rights, limited social options, and greater vulnerabilities to risks and crises. And I'd like here to take your attention back to the life cycle approach that Aradhana presented, and where we can clearly see that at all stages and ages of this life cycle, gender is one of the main categories with which vulnerability and poverty play out. Now, coming to social protection then, of course, we know that women are very often target beneficiaries of social protection programs. And this is mainly because there are assumptions about women's nature, about their resilience, about their gender roles, but also, the fact that women are actually at the front line of dealing with poverty doesn't go unnoticed. So women are intensively dealing with cuts in public services, in rising food prices, and there's also an increasing gap between responsibilities and rewards. So when we think about intersectionality, especially in the field of nutrition and in social protection, I would contest that it is really important that we think about gender as one of those cross-cutting sources of risk and vulnerability that is really important not to forget, whether it's in indigenous rights or it's in disability rights. The idea is, so for example, in these disability inclusion assessments that Aradhana talked about, do these take into account the fact that gender again is a cross-cutting source of vulnerability to even disabled people. So I think that would be my first point. I don't know what has happened in the chat box because I don't have access to it, but I will see later whether anybody thought about the visibility. And Juan Gonzalez, he talked about the visibility, visibilizing the nature of risks and vulnerabilities, but also there's one thing that I found missing also, Nick, in your presentation, which is about the understanding of one of the basic structural drivers of inequality, because I really like your definition of inequities being, the reasons why these inequalities exist. And one of the main reasons why inequalities exist is because there is a very strong gender division of labor in the household. So when we talk about targeting households, one often can forget that there are gendered division of responsibilities, of rights, and that this is a really important aspect of why inequalities exist. So that brings me to say that what we really need to visibilize is care work, which is meeting the emotional developmental, material, spiritual needs of other people through direct personal relationships. And these relationships of care are mostly taken place within the household, and this makes it very invisible to policymakers, to researchers, and to practitioners, even those designing well-intentioned social protection programs. And this is why a few years ago, I did a study on the number of social protection programs that actually took into account care, and saw that there was only 21% of social protection programs worldwide that talked about care. And why I'm talking about care is because it intersects this whole life cycle approach that from very young people to right to old age. I was really heartened to hear about the fact that the new report that Nick has presented is talking about the 3 R's: recognition, redistribution, and representation, which were actually, if you go back to the source of this, it was Nancy Fraser who coined the representation and the recognition aspect. And then when it came to care and visibilizing care, it was Professor Diane Elson who talked about the 3rd R, which was about reduction, and the reduction of care and of care work in terms of the amount of care that women put in, as well as the reduction in the drudgery of care. And then, of course, ILO and Oxfam and others, people added the 4th R of representation and then finally of reward. But I think the main thing to go back to is again that recognition. And in that recognition, it is really important that social protection programs and nutrition programs and food security programs recognize that it is not just enough to differentiate by gender, but actually to be care sensitive. And what this means is that while gender differentiated measures can target women, can think about the ways in which women are facing these vulnerabilities, it is only care sensitive measures that talk about specifically about the unequal burden and the unequal distribution of care. And here, I'd just like to end with one thing that I really would like to emphasize, which is that we don't want to think about care as a bad thing. Care is not a burden. Care is a good thing. And this is really important to understand, because we need to increase, and I heard a lot of things about accessibility and availability and inclusivity. But I think if you think about the quality of services and the quality of care, then one really thinks about these very deep-rooted structural inequalities without dealing with. If you don't deal with these structural inequalities, you're not going to be able to meet the goals that the Sustainable Development Goals and other aspects are aiming at. So yeah, Alice, I mean, we talk about patriarchy, but unless we talk about care sensitivity and not just gender differentiation, we're not going to get very far.
Thanks for that. I was thinking about one of the paradoxes that we have in this agenda of making social protection inclusive. The first thing is, I think that there are two paradoxes, and that's why the title of this webinar, as Alice said. The first paradox, and we can talk a little bit about that, and the case of India has highlighted that, is social protection targets the poor and the vulnerable, but oftentimes the poorest and the most vulnerable fall through the cracks. And that goes kind of against what social protection has signed up to do. And today, Julie Lawson-McDowell from Save the Children was reminding us in this amazing conference organized at IDS by the Center of Social Protection that, social protection was brought into the picture to really be able to catch, to protect, to uplift the people that were falling through the cracks. And if social protection is not doing that, then Houston, we have a problem. Yeah. Number one. And the second thing is the paradox that by doing this inclusion work, making social protection inclusive, for as redundant as for so many people this may sound, but considering that first paradox, how needy it is that we do that, is that by including one group, we don't forget about the other, that we are not gender sensitive, but that we're disability blind, that we are child sensitive, but we forget about old age. And that's often the case, and the fragmentation of this agenda is not helping us to really fulfill the role of social protection. And I wanted to say, we've spoken about SDG target 1.3. Now, let's talk about target 5.4, another in the SDGs where there is an explicit mention of social protection supporting care to advance this very, very much needed gender equality we need around the world. And it's about men. What is the role of men? And it's about redistributing with who? It's with the state, but also so that the state takes due and fair share of the responsibility that it's shouldered by women everywhere. But second, what about men, and how do we incentivize them to really play them, to play a role? And we have in hunger studies. We had a study that Stephen mentioned many years ago in another webinar in 2019, a study by Haddad and Smith in 2000, where did analysis on the analysis of what were the main drivers of hunger reduction, food insecurity, malnutrition, and it was the literacy and the education of women, and there was a reduction 43%. But what if we empowered men and we also direct SBCC, social behavioral change interventions, and we put the conditionalities also on men? Maybe we would have a reduction that is bigger on that. What's your take on that involvement and that redistribution, and having a gender lens that really puts men to play an active role? What do you think?
Okay, I think that is definitely a very good point. And I think, like you said, the redistribution is not just for the state, but also to men. I think I'd flip it the other way around. I'd say that actually social, redistribution is not only to men who also work very hard, especially in poor, marginalized communities. It's not men versus women. It's actually poor households and vulnerable households struggling to make ends meet. So in that case, I think putting burden on men who might have migrated for work or other opportunities, etc., doesn't really fulfill the main picture. So yes, while social behavior change is very, very important in order to shift the gender norms, I think equally important is the role of the state in addressing gender norms. And if policies are not are not made with the care-sensitive lens by policymakers, most of whom are men, and don't think about care and don't think about gender, then I don't think that can, to target the ordinary citizen and person who's who happens to be a male is probably unfair. So I'd rather flip that around a bit.
Good. Love the discussion. And now we're going to the Q&A session and to see if we have anything from the audience as well.
Yes. So first I'll take a few questions from the chat. Thank you for those who've asked questions. I can ask two questions to Francisco. Are there other factors affecting food security in a given country? Maybe you can talk about Mexico in consideration with climatic conditions. And there's another question for you. I would be interested to know, asks Carol Watson from the Mexico presentation, what is meant by social vulnerability and why, according to the graph, this is rising in contrast to poverty that is declining? Thank you.
Okay, thank you so much. The answer to Haruna and to Hassan, well, food insecurity is a multifactorial. In the case of Mexico, the biggest challenge for food security is an economical capacity. However, resilience to climate change is essential. In our country, there is a constant drought in the north, as well as floods in the south. That is why from the vision of social protection, we must focus on three main activities to strengthen resilience. The first one is promote family and community agriculture to reduce the agri-food chains. The second one is strengthen the capacities of rural communities to react and prepare for a climate emergency. And the last one is bring science and technology closer to communities so then they have mechanisms to allow them to combat the negative effects of climate emergency condition. We see the social protection like a transversal and intersectoral activity. And for the second question, social vulnerability means a population that has one or more social deficiencies, but whose income is higher than the well-being line. Consider these variables: educational lag, access to health services, access to social security, housing quality and spaces, access to basic housing services, and access to food. Extreme poverty is when a person is in a situation of extreme poverty. When they have 3 or more deficiencies out of 6 possible within the social deficiency index and are also below the line of minimum welfare. As mentioned in the slide 5, where we talk about international external factors such as the pandemic and wars that increase prices, limiting access to certain products and basic services.
Thank you, Francisco. Another question from the audience, maybe to you, Deepta. Could you shed light on the nutrition with respect of time poverty, which typically women face, and how is it that it can be addressed? From Sanchi, Madame.
I think, okay, so perhaps the question is about the nutrition deficits that women face because of time poverty, I think. And I think that is a really, really good point. And you know, the determinant of nutrition is not just the availability of food and nutritious food, but also in terms of the preparation of it. So if you know, and we actually see that a lot of time is spent not in the procurement, but actually in the preparation of food. And I think that's something that is really important to understand if we have to understand nutrition. So it's not probably enough just to go to kind of like, you know, say, okay, we've delivered quality food, but actually what sort? If you've delivered raw material that requires pounding for hours before you can get flour out of it or something, then actually you're actually reversing the trend of nutrition rather than going the other way around.
Thank you, Deepta. There was a question maybe for Aradhana or someone here. Oh, I just lost it. How can issues of inclusion and exclusion be minimized in social protection programs? Aradhana, do you want to take this one?
Yeah, I can. From our experience, I'll share that what we have done is ensure that there is elimination of duplication in terms of the intended beneficiaries. There is rationalization by matching the beneficiary records with the citizen ID, which is unique, and in India it's called Aadhaar card. Those are unique citizen IDs, and they are then all of these the beneficiary cards, which are known as ration cards, at least for the targeted public distribution scheme, were matched with the unique citizen IDs to ensure that the beneficiary that was registered was actually the real one. We then also through community campaigns encouraged all the eligible beneficiaries who were left out to come forth and register themselves. Now this is something that is taken up by the state governments on a regular basis. So every year we have this kind of community campaigns where citizens are encouraged those who have been who are eligible but have been left out for some reason to come forth and register themselves. So it is really an ongoing and continuous engagement with the community and the government that helps in actually connecting more and more deserving people to the scheme. And also this whole process of tallying with the citizen IDs has really helped us to eliminate those who do not deserve to be in the scheme but still are registered. I hope that answers the question.
I think it does, Aradhana. I'm aware we're running a bit out of time. We'll try to wrap up quite soon. There might be a question in the audience. No. So there's another question on the chat. I think it might, anyone can maybe raise their hand to take it. What are some of the successful mechanisms and incentives that have been used to encourage and promote intersectoral collaboration and synergies around these issues, given that this is so critical to improved outcomes? Maybe Francisco or Aradhana. So what successful mechanisms to promote intersectoral collaboration? We've seen of the necessity to collaborate between ministries, between different stakeholders. Maybe Francisco.
I could also add to it from our experience. So we have a mechanism in India is for whenever there is any legislation or any policy that is drafted, it is put out in the public domain for responses from the wider community. And a lot of the, again, the NGO sector in India is also pretty organized, and we have associations of various categories of civil society organizations who then come together and produce coordinated responses or comments on the proposed new policies or schemes. The UN agencies also play a critical role in bringing together all of these various stakeholders and preparing consolidated responses on the policies, on the schemes, and which are then further shared with the government. For some issues, for example, disability inclusion, where you have different departments dealing with different aspects of the social protection schemes that are available for persons with disabilities. Bringing together all of these departments is very essential if we really want to address the gaps that exist towards their access to social protection schemes. And then again here, WFP has been making that effort, and the government has been very positive towards it. So yes, the mechanisms are informal as well as some formal also exist. But yes, a consistent effort is required to ensure that it really is implemented as intended. Thank you.
Thank you, Aradhana. And there's one more question in the chat. It talks about climate. In the wake of climatic conditions and threats, what solutions are available to be able to curb the food insecurity and nutrition issues in developing countries like the Gambia, for instance, that almost rely on imported food to feed the population? I know, Francisco, it seems that you've provided an answer. Do you want to say a few words on climate?
It's okay. It's the same. Is the same answer to the another question. I don't want to share more.
Okay, great. Thank you. Do any of the panelists want to add a few words, share a few thoughts before we wrap up the session?
Well, I just want to say on that climate consideration, I think the one of the messages of the HRP report was just to think about winners as well as losers, and kind of drawing on Deepta's point, which I strongly agree with, is kind of winners and losers in terms of care burdens that come out not just from the food security system, but also from dealing with the impacts of vulnerability in shocks and other crises as well. So I think that's a really important point, but I'd like to hand over to Deepta to add more on the climate point if you want to.
I'll make a final different point. Actually going back to the issue of intersectoral coordination. I think that one of the lessons that we've learned from country experiences across the world is that the best way to achieve sustained and significant improvements in nutrition status and food insecurity and hunger is when you focus on the objective rather than the instrument. And by that, I mean that as social protection experts, we might focus specifically on whether it's school feeding or cash transfers. If you come with a gender lens, you focus on the issue of care. Of course, these are important issues. But if you deal with them in isolation, you don't get the synergy that you get when you say, what is the problem of hunger? What's causing it? What's driving it? And recognizing that malnutrition is not just about inadequate access to food or not enough cash in the household. It's also about childcare practices, also about clean water supply, sanitation, hygienic practices around food preparation. And so having a concerted attack on hunger and food insecurity and malnutrition requires focusing on that objective, not on saying we're going to use this instrument to attack the problem. And if you look at cases like the Zero Hunger campaign in Brazil, for example, that's one example among several, where the focus was on zero hunger, not on cash transfers. So I think we should see social protection as one of those tools that together, working together synergistically with other sectors and instruments and rights and laws, can achieve that ultimate goal that we want, is to eradicate hunger, malnutrition, and food insecurity.
Perfect. I think that's a wrap, isn't it? And I want to thank Alice for her incredible moderation, for our participants who are online that have stayed with us, but in particular to the Mexican government, to our colleague from the WFP office in India, and of course to our super academics who have joined us here from the Institute of Development Studies, which is ranked as the best international development institute in the world. So we're very proud to have you, and have Stephen and Deepta and Nick sharing the research, which speaks to this issue of how inequalities affect malnutrition and this fight for a world free of hunger. Thank you, Alice, and for organizing this to the socialprotection.org team. That is fantastic. Fabiana and others that are always making these webinars and exchanges happen, and everyone in the chat and in the audience that participated and shared their thoughts and their greetings from various parts of the world. So thank you very much, and have a lovely rest of the day. Take care. Bye.
Thank you.